If you want to achieve 4 out of 4 medicine offers or be studying in your dream university next year, then this is the video for you. Now, one of the most important steps to achieving that is achieving interview success. The first step to doing that is knowing your content. So in this video, I'm going to be covering the NHS hot topic of the staffing shortages, so you can know everything about the staffing shortages and be able to answer questions in your interviews. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Let's start off by taking a look at the current state of the NHS and the staffing shortages that they're facing at the moment. Within the NHS now, there are currently significant vacant positions in secondary care, so this includes hospitals, not just for doctors but also other healthcare professionals too. This reduction means that there is a greater workload on the current healthcare professionals within the system. Additionally, there's also been a reduction in the number of GPs, which means that there is greater pressure on existing GPs who are already working within the system. Staffing shortages can often lead to burnout and a high workload for all the doctors and healthcare professionals who are currently working, and over the long term this could lead to doctors or other healthcare professionals actually leaving the NHS and choosing different training positions, which is why it's really important to address the staffing crisis to make sure that all staff are actually being well supported so that they can then deliver the best care possible to patients. Currently, the NHS is suffering from staffing shortages due to 2 reasons. First is that there is a difficulty in predicting the number of healthcare professionals that may be needed. This is because for many healthcare degrees they often have a long training process, and for the government it's often difficult to gauge within 10 years time how many healthcare professionals they may need. As a result, allocating funding may not always be a clear idea, and this is what makes it difficult when deciding how much funding to give for the training of different healthcare professionals. The NHS also relies on nurses and healthcare professionals and doctors and allied healthcare professionals to come from other countries and work within the UK. If there aren't as many healthcare professionals from other countries working in the UK, again this creates those vacant positions, creating staffing shortages and meaning a higher workload, more longer waiting lists and more burnout for the current staff within the NHS. In order to address this issue of staffing shortages, one of the things that the government has stated it's going to do is to increase the number of medical school places. This means that more medical school students can be trained and then they can enter the NHS as doctors to help support the healthcare system. However, if you're discussing this in your medical school interviews, I think a really important point to highlight is that it's also important that the number of specialty training posts is also increased too. So it's important to increase the number of medical school places so that there are more students getting into medicine and becoming doctors, but then in order to be able to train as specialist doctors, the number of specialty training posts should also be increased too, and funding for these could also be increased, as it means that again we have more specialist doctors alleviating pressure from the NHS in loads of different areas. To help alleviate pressure in primary care specifically, the government has announced further funding into primary care services. This is something that we look at a little bit in the GP services and primary care video as an NHS hot topic, but I'll talk about it again here. Now, more funding has been allocated to GP services, as this means that not just GPs have to see patients, but additionally other healthcare professionals such as pharmacists and physiotherapists and other allied healthcare professionals, they too can also see patients and help them with any concerns or any issues that they may have. I hope this video has helped to give you a good understanding of the current staffing situation in the NHS, some of the potential solutions for the different careers that are also affected, so that you can talk about it within your medicine interviews in an articulate and confident manner.